I'm here today to talk about hair loss in both men and women. During this video, we're going to talk about why it's happening, potentially why it's happening, what it is we can do to prevent hair loss, and how it can be treated in a medical aesthetic setting. My name is Chantal Ward, and I'm a registered nurse practicing in the medical aesthetic field. I'm here to give you all the information that you need to make sound decisions in your anti-aging journey. Hair loss for men and women can have a dramatic effect on our confidence. I don't know if you've ever gone through this. I know after I had my son, with hormonal changes and then with perimenopause and menopause, I was finding more hair in the sink, in my hairbrush. It was shedding more than normal. There are a number of reasons why people lose hair. One of them can be because of hormonal changes. It can be genetic, it could be stress, it could be disease, you could be ill, it could be because you're on some medication. There are so many factors that have an effect on our hair loss and hair growth. This presentation, we're going to dive a little bit more, not too deep, but enough to really start understanding why this is happening and what it is that you can do, how you can strategize, at what point do you go and see a medical aesthetic professional or a physician who specializes in hair grafts or hair transplants. There are so many things out there. If you were to Google it or look it up online, the list is endless. And you kind of go, where do I start? As I mentioned, it happens to all of us, both men and women. It could be genetic. Look at your family. I have a good friend. Her hair is thinning. She's kind of mid-40s. Her mother, her grandmother, they all had really thin hair. So she is going to be predisposed to that. As an individual who is working in the medical aesthetic field, sometimes I will see multi-generational people coming into clinic, and I will softly and gently have a conversation with that 35 or 40-year-old whose mother used to come to me who has thinning hair, and we'll talk a little bit about prevention or hair health. Women will discuss it very openly. Men tend to be a little bit less confident in having those conversations, but when I'm doing a consult, it's an easy transition. The key is to identify the root cause. I'll always send people back to their family practice or their family physician or their healthcare who's managing their health and really kind of getting a workup on their hormones, get an understanding of the blood work, the levels, etc. Getting an understanding of their lifestyle. Are they working in the pit at the stock exchange, crazy hours, smoking like fiends, drinking till all hours of the night, studying, whatever it is, really understanding all those extrinsic factors. So that's everything that's not within their own body, okay? Intrinsic is genetic, it's disease, it's from them. But it's all these other things that could affect our hair growth. If it's genetic and, the individual comes in and their hair is thinning, like male pattern baldness, you typically have, it goes from kind of the forehead and it goes straight back. That hair loss, if they don't have any follicles at all, anything we do in clinic is not going to stimulate growth. That type of patient or client that comes in or gentleman, they're better off going, getting an understanding of their hormones and then going for a hair transplant. But thinning of the hair, finer hair, these hormonal fluctuation, hair loss, that is something that can be a little bit easier to manage. Hormonal changes in menopause, pregnancy, PCOS, which is polycystic ovarian syndrome, where a young woman will have excessive hair growth on their body and really thinning hair in their scalp. Poor diet. If you don't have the essential nutrients and oils and fatty acids in your nutrition, this will have a direct effect on our skin and our hair health. When I used to work in the eating disorder clinic at Sick Kids Hospital, we found that a lot of these young girls and boys were losing their hair because of the malnutrition. Once they were nourished and had a better nutritional balance, their hair started growing back more vibrant, thicker and they weren't losing. So if someone's lost a lot of weight or they've had a dramatic weight loss, this can affect our hair. Medical conditions, thyroid, make sure you understand if there's a medical reason why you are losing hair. Medications, as some of you may or may not know, chemotherapy. Obviously, this is a drug that's treating a cancer. It will have an effect on healthy cells as well. So one of the byproducts is that you may lose your hair. Birth control pills, antidepressants, blood pressure pills all have a potential effect on our hair, making it thinner, finer, not as healthy to go through the 4 stages of hair growth. So when we talk about hormonal imbalances, there's the genetic factor, there's the hormonal, you've got these different cycles. There's 4 cycles of hair growth. You've got anagen, catagen, telogen, and exogen. Our hair every month goes through these 4 cycles and they will naturally shed. But if you have excessive shedding, you have to understand why. Men often have a receding hairline or a crown thinning. Women will have a widening of a part. So if they're used to parting their hair down the center or off to the side, you'll actually see that that part will become a little bit larger or a little bit thinner, or you'll see more scalp. Lifestyle and external factors. So whether it's stress or, you've gone on that diet or you've gone Ozempic, you'll actually have an exceeding amount of hair shedding potentially. Overuse of hairstyling. You see these young girls ironing their hair, curling their hair, hot rolling their hair. It's endless. And you can see that all of these treatments will cause excessive heat and injury to the cuticle of the hair follicle and cause breakage, which then reduces the healthiness of that hair. So people who wear tight ponytails, I know I have a couple of friends that like wearing a tight ponytail because it says it gives them a nice brow lift. Well, no, you don't want to do that, because the more you braid, the more you pull back, the more damage you're causing to the hair follicle. So they call that traction alopecia. Let's talk about effective hair loss treatment. So first of all, getting an understanding of what's happening. I mean, if you have alopecia and you've got male pattern baldness and it's thinning and you've got, a family history of hair loss, I mean, you could definitely go right into a hair transplant or get an assessment with a dermatologist who specializes in hair, or a trichologist. A trichologist is somebody who does study hair loss, and they will actually help you decipher exactly what kind of hair loss you have and give it a name. Topical treatments such as minoxidil, scalp serums, medication shampoos, they're all great. But you need to find which one is going to be appropriate for you. Oral medications such as finasteride for men, hormone therapy for women. I know a lot of women, as they enter into perimenopause, will go into a depletion in so many hormones and vitamins that getting on bioidentical hormone replacement therapy will help stop the thinning of the hair or the hair loss. Doing a low-level LED light, one of those helmets that you see online. Now you have to be mindful, not all of them are good, so you have to do your homework. The cheapest isn't the best. There are some out there that have spent a lot of time getting peer-reviewed clinical papers, so do your homework to really understand which one of those LED helmets is going to be best for you. Dietary improvements, that's going to be your easiest thing. Getting on an iron, getting on a zinc, making sure you're getting enough protein. If you're a vegetarian, a vegan, how are you going to replace that protein that you need? Biotin is a vitamin supplement that you can take that's good for hair and nails, or even a vitamin D. Lifestyle changes will help, reduce the stress as much as you can. Exercise. Make sure you avoid excessive heat styling with your curlers. Use gentle hair care or hair products. Avoid tight hairstyles. People are using those roller brushes, and I know I tried, and every once in a while my hair gets stuck in it and I'm yanking on it. So try not to use those types of brushes. So prevention is going to be your easiest thing, especially if you have a family history of thinning hair or hair loss. And then, what we can do is offer treatments such as microneedling with PRP, or we can do PRP injections. We also have a new technology called exosomes, and exosomes are showing incredible results. These are little vesicles. They could be plant derived, they could be human derived. They are a byproduct of a stem cell. And these little vesicles actually carry growth factors. And these growth factors have all these healing properties that can make the skin, the hair grow thicker, grow stronger. If you have a follicle that keeps trying to grow and it doesn't actually exit the scalp, then it will die off like it would normally. It would go through the catagen and the telogen phase, and then the body would metabolize it, and then that hair follicle will try to grow again. But every time it tries to grow and it doesn't go through the scalp, then it loses its viability or its strength. So by doing something like a microneedling on the scalp and then applying an exosome serum immediately afterwards, it's going to help that hair to be healthier. It's bringing growth factors in. It's going to help the collagen and the elastin, and it's going to trigger the little stem cells in that follicle to actually push out a stronger hair follicle. I mentioned PRP, so doing PRP microneedling, doing PRP injections. There's so many strategies. So what I would recommend is that you meet with your medical aesthetic provider to figure out what is the best approach in kind of diminishing the hair loss or stopping it completely and stimulating your hair to be healthier as it grows. In conclusion, hair loss affects both men and women. Understanding the key cause of it is really going to be your journey. As a medical aesthetic provider, we will be a part of that journey with you. So you're going to do your homework, you're going to talk to your doctor, figure out what's going on with your blood, what's going on with all your hormone levels. Once that's stabilized, and that can be your doctor or a naturopath, then we can actually help in clinic to actually make that hair grow healthier. Doing combination therapies, so doing the topicals, doing the PRP, doing the exosomes, the microneedling, seeing your naturopath, getting on a really good nutrition regime. All of these things are going to make your hair healthier. I hope this answers some of your questions that you're having regarding hair loss or thinning hair. If you have more questions or comments, please put them in the comment section below. Don't forget to subscribe to this channel. I'd love a thumbs up, and I can't wait to see you next time.